Hello colleagues, my name is Winnie Byanyima and I'm the head of UNAIDS since last November. It's an honor to be with you today. The COVID-19 pandemic exploded just 2 months into my tenure. Global systems were ill-prepared for the devastating impacts of COVID on health, on lives, on communities, and economies. COVID-19 reminds us that pandemics cannot be tackled by health systems alone. Far from being just a health crisis, the COVID-19 is also a rights crisis, a social crisis, and an economic crisis. And while we fight this new pandemic, we cannot lose sight of our collective goals of ending AIDS and TB by 2030. COVID-19 may have made our task harder, but this is also a moment to rethink our response to global pandemics and how we guarantee the right to health of all people. There were 24.5 million people on ARVs by mid-2019. Despite this success, less than half of the people with HIV-related TB disease received HIV and TB treatment in 2018. As a result, TB causes 1 in 3 AIDS-related deaths, despite being preventable and curable. Without concerted action, this will be worse as resources are directed to COVID. We must not repeat the mistakes of the past. From our work on HIV, we know that to beat pandemics, we must focus on addressing inequality in access and inequality in outcomes head-on. We need to capitalize on our hard-earned lessons from the AIDS response around the importance of communities, human rights, and a multi-sectoral approach to build systems for health that can absorb the current COVID shockwaves and future-proof us against other pandemics. I want to share 3 priority areas in this pivotal moment. Essential to all 3 and all our work must be the meaningful engagement of and partnership with affected civil society from the outset. My first priority is rapid and equitable access to COVID innovations. This is non-negotiable. When AIDS was discovered almost 40 years ago, tests were scarce and unreliable. There was no treatment, no vaccine, or other reliable combination prevention. Does that sound familiar? However, people living with HIV challenged the system that put monopolies over essential HIV medicines, paving the way to equitable and affordable access to priority innovations for many diseases since that time. Generic production in countries such as Brazil and India drove the price of ARVs from $10,000 to less than $100 a year, and global HIV treatment coverage accelerated exponentially from less than 5% who received basic ART in 2000 to 62% global coverage of state-of-the-art HIV treatment by the end of 2018. Until a few years ago, there had been no new drugs to prevent and treat TB, and unfortunately, many of the new drugs and regimens available today remain unaffordable and inaccessible to people living in low-income countries. The poorest must benefit equally from the innovations paid for by billions of dollars of public funds invested in COVID research. People must come before profits and patents. That's why UNAIDS is co-leading the global campaign for a people's vaccine to make any COVID-19 vaccine and any other technologies patent-free, mass-produced, distributed fairly, and free at the point of use. My second priority is shaping truly multi-sectoral responses that address intersecting social and economic determinants of health. COVID, like HIV and TB, thrives on inequalities in our societies. So we must always put people at the center of responses through rights-based and gender-just approaches. We must also tackle stigma and discrimination head-on. Think about a pregnant adolescent girl living with HIV who has a cough. Think about the many layers of stigma she must overcome to get the care she needs. Compounded stigma like this leads to poorer health outcomes and has no place in our world. A recent survey of national COVID response committees showed that they are predominantly made up of politicians and biomedical scientists, with very little representation of social scientists, COVID survivors, or people affected or at-risk communities. It's little wonder strict public health measures supported by punitive laws are being implemented without creating any space for the most at risk to be able to comply or to meet their basic needs such as food. How can people living in overcrowded, informal settlements physically distance themselves? Institutionalizing the role of non-health sectors, including justice, law and order, education, private sector, and civil society, in tackling epidemics is central to overcoming HIV, TB, and COVID, and more broadly, for achieving the Sustainable Development Goals. My third priority, we need to move away from one-size-fits-all approaches to more effective, sustainable, and people-centered approaches driven by real-time, disaggregated data. Community-led monitoring adds speed and detail in reporting drug stockouts, human rights violations, and stigma and discrimination. The COVID response can expand more rapidly and effectively by harnessing existing infrastructure built through TB and HIV investments, supply chains, data systems, laboratories, trial networks, and community infrastructure. All these are available. For example, without the multipurpose lab machines bought for the molecular diagnosis of TB, viral hepatitis, viral load, and early infant diagnosis, most low-income countries would have little or no capacity to test for COVID today. In return, the additional COVID investments strengthen the same labs for the greater global good. COVID-19 crisis is a decisive moment for all of us. The right to health has never been higher on the global agenda. This is the time to strengthen the resilience of systems for health and future-proof the health and well-being of generations to come. This is how we will overcome this crisis and finally also end AIDS and TB. I thank you.